It is 8:32 on your Aloha Friday here on Take 2, and we've heard a lot lately about some of the dangerous things that are being emitted out of the lava flow. This happening, of course, over on Hawaii Island. One which can truly affect the entire state, though, especially if trade winds ease, and we'd heard Chris Lutronic earlier on Wake Up Today saying that could be the case over the next few days. We're talking about VOG. We want to welcome in Dr. Taken Low. He is a pulmonary medicine pulmonologist with Adventist Health Castle. If you don't mind, Doctor, VOG. We had heard Chris earlier say that trades could turn variable. When that happens, it truly could become a statewide thing, right? We're not just talking about Hawaii Island.
You're absolutely right. The VOG is basically the eruption from the volcano itself that consisted of carbon dioxide, water vapor, and the toxic sulfur dioxide. Those three things, when they're mixed in with the moistures in the air and all around water that we have and the oxygen and the sunlight, actually, and we've got plentiful of that on the islands here. It actually creates these haze, and that's what VOG is. Basically, VOG is just like fog, but it's just a lot more poison in it. And that's the problem. And when there's no wind, these haze actually stay, and it kind of affects a lot of people with their breathing.
I was going to say, because we have heard, obviously, some of our elderly or folks who maybe have asthma are bothered. But I know my wife doesn't have either of those. She gets affected by it. Scratchy throat, eyes messed up. It can really cause problems.
You're absolutely right. Some of the symptoms that even when you're healthy, you got skin problem, you got eyes problem, you got nose problem, you can't breathe, you got throat problem with soreness, and sometimes shortness of breath. Patient that actually have asthma or emphysema, and patient that have heart problem even can have wheezing, can get shortness of breath, can get chest tightness, and and coughing. Especially when they're coughing consistently all the time, more than usual.
And I was going to say, Doc, with it being June, we're already seeing the temperatures heat up. That probably doesn't help either, right? If it's really hot outside, and you don't have wind, and you have VOG, that's probably a pretty dangerous combo.
You got everything settling right here. And, and the next thing what happened, though, is as soon as the wind come back afterward, that kind of spread everything out, even to further distance, and that makes it even harder.
So you talked about some of the common things, like the coughing or maybe the burning eyes or itchy eyes. How long sometimes do these things last?
Normally, if everybody is taking a shower, making sure they stay indoor and so forth, they should last about a day or so. Now, but if some of the people that are more prone to these kind of problems, such as like extreme of ages. We're talking infants, children, old age people, patients that actually are pregnant or maybe just had a baby, or heart and lung disease patients. They can have it lasted for many, many days.
How can we go about preventing or treating VOG inhalation?
I think one of the most important things we need to do is to try to avoid. If at all possible, stay away from that area as much as you can. I can't tell you exactly how the distance is. I think the volcanic authority might be able to kind of provide you with the distance and so forth. But, I would say the avoidance is number one. Certainly those paper mask stuff, not going to cut it. Even the respirator, we got problem with fitting and so forth. So it's not really the best thing. You can stay indoor. In an environment where you can put air conditioning on, making sure that it's in the circulation mode, not the outside
bringing
vent.
that in.
Bringing that in. And when you're driving the car, don't do that vent coming out in and out as well. And also, try to make sure you get some medication. If you have heart problem or lung problem, make sure your inhalers and stuff like that are available and accessible. Hydrate yourself, rest a lot, and avoid.
Dr. Low? Thank you very much. We appreciate you being here. Adventist Health Castle, we appreciate that and that information. And we'll post that a little later on our website at KHON2.com. Doc, thank you very much.
You're most welcome.
Appreciate your time. All right, still to come on Wake Up Today. We've been telling you about it. We're talking about Bruno Mars. I know Dr. Low. He's excited about this, right?
I am right there.